Hey, my name is Jerry McMullen. I'm going to do my project on schizophrenia. Schizophrenia is a mood disorder, a mental disease, and when you look at the title of chapter 19, this is the only one that I've seen that's got basically a disclaimer right here. It says that the treatment and prevention of mental disorders are currently being debated. So I thought that was pretty interesting. In all 49 chapters of the book, this is the only thing that the doctors or the scientists are kind of saying, we don't completely have it figured out yet. So this guy named Eugene Bleuler was the first to call this disease schizophrenia back in 1911. He said that it was an illness of the mind, and basically even now there is no cure. All the tests, all the medications, all the treatments, there is no cure for it. You're just kind of stuck with it, and you kind of deal with it as best you can. It affects basically 1% of the U.S. population. So, for every 100 people that you know, there could be one of those who suffer from schizophrenia. And this happens to be a disease that is very stigmatized. People who have it sometimes don't like other people to know that they have it. It's kind of embarrassing to them. And also, people tend to make fun of those who have schizophrenia because of the various symptoms that they have. One of the things that can determine whether or not people have schizophrenia are certain genetic factors that can be passed from their mother and father. Genes that carry schizophrenia can be inherited, but it's not absolute. Basically, your father could have schizophrenia, and the gene could pass to you or another sibling, and the gene may be expressed, it may not, because of what they call reduced penetrance. So it's not like gene studies can be completely, comprehensive and explain whether or not somebody may or may not have schizophrenia in the future. And there's also mainly environmental factors that the scientists think that could affect the person's likelihood of getting schizophrenia in the womb. Infections in the womb, malnutrition in the womb can have a great deal of influence on whether or not the child develops schizophrenia later in life. Childhood schizophrenia is very rare. Usually schizophrenia takes its onset in late teens, early 20s, sometimes in the 30s. And supposedly, according to the book, just by living in an urban environment can increase your likelihood of developing schizophrenia. So if you live in a place like this, you may want to reconsider moving to a place like this. So when scientists are studying the brain to determine what makes schizophrenia occur, they like to do imaging with MRI. They study pictures of the brain, they look at the shape, they look at the size of the different parts, and that helps them make a determination what is going on here. So when they're looking at brain, they can see that the lateral and third ventricles become enlarged. So what that means to me is that when you have a ventricle, which is an open space, when it gets bigger, the tissue of the brain around it is actually becoming smaller. And so also we have widening of the frontocortical fissures and sulci, which also means that spaces are becoming greater. The brain is slowly shrinking in a way. Also, the thalamus and the temporal lobes have a reduced size. The images in affected adolescents can also show that the gray matter is shrinking. It's less gray matter, therefore less brain tissue to use to think and have emotions and control emotions, that kind of thing. whenever they're doing studies on schizophrenia, they also look at the different chemicals of the brain to try to determine what makes schizophrenia happen. Use who have kids may have heard of the cartoon called Yo Gabba Gabba. Always thought that was interesting. I never knew that they may have gotten it from this acid called gamma aminobutyric acid. They call it GABA for short. They are thinking that alterations impairs the normal cognitive and emotional functions of the brain. So if that acid or that chemical is not at the right level, that could have a definite impact on the brain, causing schizophrenia. Dopamine hypothesis was first thought that too much of the dopamine can cause schizophrenia, and then they come up with drugs to diminish that, and they saw that they could control the symptoms. But now they're also saying that just altered pathways and the dopamine and the way that it travels can affect the way that the brain functions and lead to an onset of schizophrenia. There's also the glutamate hypothesis, which is basically glutamate receptors and whether or not they fully process the glutamate that's there, and also is there enough glutamate in the beginning, kind of like insulin, I guess. Is there enough of it? Is it processed and received? That all affects the way the brain functions. So when doctors are trying to diagnose someone who may have schizophrenia, they look at basically 3 categories of symptoms. They call them positive, negative, and cognitive. I don't really know why they would call any symptoms positive, but that's just the way they do it. The positive symptoms are basically the ones that happen when the schizophrenic person is what they call sick or in a psychotic episode. And basically it can have lots of things like voices. Voices are a type of hallucination. People who have schizophrenia often have hallucinations and delusions. Common hallucinations are hearing voices, voices that tell them things that are not true, voices that tell people to do bad things, voices that tell them they're not who they think they are. Like this guy right here, he says, aliens are contacting me, they're following me. Maybe I'm not, who I am, maybe I'm Jesus. Where are the voices coming from? They hear voices and there's nobody there speaking to them. Also, the negative symptoms are the ones that can affect your affect, the way you look, the way people perceive you. Like this guy here, I think you'll probably know who he is. His face right now is very flat. Doesn't really show a smile or a frown, happy or sad. He's just kind of just blank. Alogia is the absence of words when people are trying to speak. They really can't say what they want to, and sometimes they just don't have much to say. Anhedonia is basically the absence of pleasure or happiness. People no longer can find happiness in the things that they used to do. They're just kind of there. Avolition and apathy. Sometimes people with schizophrenia can have bad things that happen in their lives and it's not really going to affect them that much because they're just sort of apathetic to everything. They just don't really care what happens. And this is also what causes a lot of folks with schizophrenia to neglect the way that they look and care for themselves. Typically, schizophrenia patients who are untreated will have bad hygiene, bad grooming, they won't bathe, sometimes they won't put on clean clothes, stuff like this. Then there's the cognitive symptoms. This is the things that affect the way they actually think and try to reason with things. Basically, people with schizophrenia who are affected may have trouble talking to a person in a normal way. A simple conversation can be difficult. Often they will be distracted, or often they won't have any interest to stick with what you're saying. A lot of times it'll just be memory deficits. They won't remember what they're trying to talk about. They may have an idea of something they want to talk about, and then it leaves them. Sometimes people with schizophrenia can just have a real lack of insight. They may be aware that their carpet needs to be vacuumed, but for whatever reason they can't use problem-making decisions, problem-solving decisions to say, okay, I need to go to the closet, get the vacuum cleaner, plug it into the wall, and run it up and down the carpet until it's clean. Same thing for common household chores. They just have difficulty with simple tasks. So treatment usually is best achieved by a combination of medications and therapy. Medications, you have two different categories right now. You got your basically the conventional antipsychotics, the ones that have been around for a long time, Prolixin, Haldol, Thorazine, Mellaril. These are often effective, but they can have a lot of risks with tardive dyskinesia. Basically, you'll see symptoms like pill rolling of the tongue, movement of the hands, shaking. There's all kinds of things that can happen with this. And the thing about the tardive dyskinesia is once you get it, you usually can't get rid of it. It's stuck with you. Your second generation atypical antipsychotics are like the Abilify, Clozaril, Zyprexa, Seroquel, Risperdal, Geodon. Most of you have heard of these. These can be very effective, but also very expensive. For some of your long-acting injectables like Abilify or Invega, some of those injections for a 30-day supply can range from $1,800 to $2,400 per month for a 30-day supply, and they have to have them every month. And also, these are not without side effects as well. They can cause men to have breast tissue, and also can cause an increase in different lab levels that can indicate liver damage. And so these are also, not great medications. They all have their drawbacks. So therapy usually is what they call cognitive behavioral therapy. And it's basically one-on-one therapy with a therapist, and it makes the person with schizophrenia think about things that they perceive as real, makes them kind of face off with things that are difficult to talk about, helps them kind of orient themselves to reality, and usually only works if they're taking their medication and stable. Therapy of any kind usually is not very effective at all if they're not taking their medication as prescribed. So one of the things I like for everybody to remember is that schizophrenia is not a curable disease. People don't actually have a choice whether they get it. Sometimes it can be brought on by the use of illicit street drugs, but many times they're just born with the aptitude, and their environment can trigger the disease to come about. And basically, a child's upbringing can even trigger schizophrenia. So, we need to be aware of it and try to remember that if we see somebody who's not acting normally, or may have issues with keeping themselves clean, or they're acting just kind of strange, we should probably try to reach out to them and help them rather than criticizing or coming up with our own theories about what they may be doing wrong.